I'm Dr. Joy Carter, coming to you live from Veterinary Emergency Group in Fort Lauderdale. And today we're going to discuss all things you need to know about taking care of your pets as they get older. Our first question of the day comes to us from Lanny, who reached out to us through our website, allhealthtv.com. Hello, Dr. Carter. We have a cockapoo mocha who's about to turn 10. I'd like to know, what are the most common health issues that senior dogs face? Hi, Lanny. This is a really good question. Okay. So, as far as issues that senior dogs face, arthritis is going to be one of your top ones. As you know, you do tend to see that more in your larger breed dogs, but certainly in some of your small and toy breed dogs, you can see that also. Okay. Kidney disease is another one. We do tend to see it more in cats, but certainly it can see in dogs also. Periodontal disease, or basically dental disease, that tends to be a bigger problem in our small and our toy breed dogs. That's why regular dental cleanings are very important for pets as they start to age. Basically, heart conditions such as mitral valve prolapse or going into heart failure, that is something else that we see in senior dogs, and you tend to see that in more small and toy breed dogs also. Other types of endocrine disorders or disorders to do kind of with hormones, such as Cushing's disease, diabetes, hypothyroidism, where the thyroid levels are too low. You can see that in older dogs. And then hyperthyroidism, you can tend to see that in older cats. So hopefully your cockapoo doesn't have any of these issues, but hopefully this answers your question so you can kind of know what to look out for with Mocha. All right, our next question comes to us from Dawn, who reached out through our Facebook page. Hi, Dr. Carter. We have a Persian cat, Anahita, who's getting on in years. Our question is this: are there specific vaccinations or preventative treatments that older cats need? Hi, Dawn. It's a really good question. Thank you for watching this show. So, as far as vaccines, the vaccines are going to be the same when they get older as when they are younger. Now, if your pet has some type of autoimmune condition, or unfortunately maybe was diagnosed with some type of cancer, then vaccines may not be recommended. And that is something that you can certainly speak with your primary veterinarian about. As far as, other things, for older cats and treatments and things like that, I'm going to talk about it maybe a little bit later, hopefully, but there are some new treatments for arthritis in cats. One thing I definitely recommend for cats is having yearly blood work done once they start to get over the age of 10. Cats are very good at hiding disease, okay? A lot of times they don't show that they're sick until they're very, very sick. And so if we can pick up things like hyperthyroidism, kidney disease, diabetes, things like that, if we can pick up on it when it's very early in the course of disease, then we're better able to treat it and hopefully extend their lifespan. So hopefully this answers your question for you, Don. All right, we just got another question from Facebook from one of our loyal viewers. This is from Kyle. Hey Doc, our Mastiff Zen was diagnosed with arthritis. We'd love to know what kind of treatments and lifestyle changes can help make him more comfortable. Hi, Kyle. This is a really good question. So there are a lot of new things that just recently came out on the market for pets with arthritis. In particular, there is an injection that is given monthly. In dogs, it is called Librela, and in cats, it's called Silencia. Most veterinarians offer these injections. It basically inhibits something called the nerve growth factor. And the nerve growth factor has to play a role with pain and inflammation when it comes to arthritis. I personally have not given these injections because I work in the ER, but I know a lot of general veterinarians that have given these injections, and I have spoken with clients that have given these injections to their pet, and they definitely do recommend it. The other type of injection that has kind of been out on the market for a little bit longer is something called Adequan, okay? This basically is an injection that helps rebuild and helps prevent the breakdown of cartilage. It's usually given once or twice a week for about a month time period, and this is something that would be done at your veterinarian's office. Other things out there's a new type of non-steroidal anti-inflammatory drug. It's called Galliprant, that is for dogs, can be given on a daily basis. It works very well. And it actually has benefits in the sense of that it doesn't affect the liver, the kidneys, the GI tract, like some of our older NSAID drugs, such as Rimadyl or Carprofen, meloxicam, Previcox, Duracox, things like that. So it's a little bit safer for our older pets. Another thing is too is acupuncture. Okay, there are veterinarians that are trained in acupuncture, and there's a lot of veterinarians that are actually doing that. So that is something that I definitely recommend. If your veterinarian does not provide that service, please ask them, or you can Google. And there are definitely a lot of veterinarians in the South Florida area that do offer acupuncture. Some of them will actually come to your house and do it on your pet. Another thing that's been out there and we use in human medicine has been stem cell therapy, and they're starting now to use that in pets. So, good thing is, Kyle, if your pet is suffering from arthritis, there are a lot of new treatment options out there to make your pet more comfortable. So, thank you for asking that question.